Our political science 101 group is presenting on a public health topic. We have chosen to cover the Kaiser Permanente strike. This presentation is by Avalon, Bella, Caitlin, Davis, and Natalie.
So what do health professionals do? So health professionals provide solutions for patients regarding physical impairments. They also diagnose patients and provide medications. There are several categories of health professionals, such as dentists and mental health professionals, but today we will be focusing on professionals working in a hospital, such as nurses and doctors. The main issue is that people spend several years of schooling and money on an education, therefore medical workers at Kaiser don't feel compensated enough for their efforts. So what is Kaiser Permanente? It's a large nonprofit organization where medical professionals work. So I'm just going to be doing a short timeline of significant events on the history of Kaiser Permanente. In 1930, Henry J. Kaiser, a recent USC graduate, wanted to provide affordable healthcare during the Great Depression. In 1938, the Kaiser Company had 3 hospitals and 10 doctors, created with the help of Dr. Sidney Garfield. In 1941, Kaiser Permanente Oakland Hospital opened for people involved in World War II and was made public in 1945. In 1948, Kaiser Permanente became a non-profit organization. In 1978, there were complaints of medical wrongdoings, but Kaiser turned to private arbitration to settle these complaints. This led to their bad reputation. And in 2023, they are dealing with the effects of the strike, which will be detailed in the next couple of slides. So this photo on the right is the Contractors General Hospital, built in 1933 by Garfield.
It is clear that the American healthcare worker shortage is growing year by year, and that our professionals don't feel compensated enough for their efforts. The shortage can be attributed to multiple factors, one of which is an aging population. According to the U.S. Census Bureau, about 16.5% of Americans were aged 65 plus in 2021. With an aging population, you get more professionals retiring in their field, needing more care themselves as they get older, or sometimes not being able to work full-time anymore. However, the most significant reason behind the shortage is mass burnout. The pandemic definitely exacerbated stress and exhaustion among clinical staff, as the burnout figure rose to 40% in 2022 amongst American healthcare workers. These professionals are feeling overwhelmed, underrepresented, and overworked as these shifts are being doubled and so on. The demand is higher than the supply, which leads to the unfair treatment of Kaiser employees in terms of security, pay, and benefits. There was a net loss of $4.5 billion in Kaiser's company, yet there was a $4.2 billion increase in operating expenses for the hospital. This is due to Kaiser's lack of government funding, as they aren't making as much money, which ultimately cuts the workers' wages. And for every conflict, there are many possible solutions that can be made by the public as well as the organization or the organizations involved. One possible solution must be taken by Kaiser themselves. They must listen to their professionals and take into account the struggle they are facing and adjust their priorities accordingly in terms of fair pay and benefits. However, the blame cannot all be put on Kaiser because of the fact that they are losing money and not earning as much from government funding. As of October 13th, however, Kaiser has announced a tentative new agreement for its workers and unions, specifically coalition-represented employees that will pay $25 an hour in California and $23 in other states. However, everything is tentative. Another possible solution on part of the community is to gather healthcare employees from underrepresented communities to bridge connection and better understand the community's needs and issues. Raising awareness and encouraging our first responders is a great way to boost morale and get Kaiser's attention.
Who is involved with the Kaiser Permanente? 75,000 Kaiser employees that work across California, Colorado, Washington, Virginia, Oregon, and Washington, D.C. The unionized group makes up 40% of Kaiser's total staff and includes nursing staff, dietary workers, receptionists, optometrists, and pharmacists. In San Francisco, California has the most members supporting the strike at 68,475, whereas Oregon only has 4,000 members on strike and Colorado only has 3,000 members striking. Virginia and DC only have 180 members that wanted to strike. And overall, Kaiser workers will return to work on October 7th, 2023. And this is only temporary, and a longer, stronger strike may rise in November if a deal between the coalition and Kaiser is not agreed upon.
So for what is Kaiser Permanente? They are an Oakland-based healthcare provider established in 1945, where the company had remained a trustworthy corporation for several decades. In the most recent decade, the company has faced several legal allegations regarding Medicare fraud by submitting inaccurate patient diagnostics to receive higher government reimbursements. By 2022, the post-COVID surge, Kaiser was already facing several trials regarding their misconduct of patient medical records and hazards. Most recently, Kaiser experienced a strike from 75,000 healthcare workers, specifically in pursuit of raising the minimum wage for its workers, revising the labor contract that's been stagnant since pre-COVID-19 response. The strike began on October 4th and ran for 3 days with the goal of reaching a contract settlement for the union. They are demanding improvement for work environment as well as better compensation for the compromising staffing levels, such as reimbursement for overtime and better paid hours.
Why did the strike take place? The first reason was to combat staff shortages. According to CNN, who communicated with workers engaging in the strike, striking employees say staff shortages have left them feeling overworked and burnt out. This idea is further evident in a New York Times interview with Edith Borato, medical assistant at a Kaiser clinic in San Francisco. She expressed that she went on strike because her job was getting exhausting and that patients were waiting longer for care because her clinic was so short-staffed. Therefore, the shortage did not only affect employees, but also cause patients to not receive the level of care they expect and deserve. With these two factors combined, staff members felt it was their duty to stand up for themselves and their community, thus resulting in the strike. This strike also took place to demand higher pay. The strike coalition asked for across-the-board 6.5% raise in the first 2 years of the labor contract and a 5.75% raise in the next 2 years. This proposal was hard set. Kaiser offered location-dependent wage increases with a maximum increase of 4%. This increase would be for new contracts after 1 year and would continue for 4 years. Therefore, there'd be up to a 4% increase each year for 4 years. This offer was rejected by the coalition. They felt the offer failed to keep up with the cost of living. Aldina Hadzik, a licensed practical nurse, on a CBS News interview, added that the staffing shortage is due to the lack of pay employees experience. Therefore, Kaiser could kill 2 birds with 1 stone by raising their wages. Hadzik also mentioned that Kaiser is in a losing battle with travel agencies and rehabs when it comes to staffing. She states this is due to higher pay offered at those facilities. Looking further into this claim, Hadzik has a good point. Being employed as a Kaiser healthcare worker with job titles including nursing staff, dietary work, reception, optometry, and pharmaceutical work, there's an enterprise-wide minimum wage starting at $21 an hour, whereas working at UCSD Health as a rehab services front desk/call center specialist, starting wage is higher. Job description includes answering multi-line incoming customer calls and scheduling appointments. The minimum wage for this job is $25.42 an hour. Therefore, there's a $4.42 increase in wage off the bat. The starting minimum wage at UCSD is almost the same wage the striking coalition has been asking for. Therefore, if Kaiser raised their minimum wage, they may have more luck with staffing, solving both the reasons why the strike occurred.